Hello everyone, this is Chris, Kelly, and Aaron, and we're going to be talking to you today about dietary fat intake and breast cancer risk. It has been stated diet is significantly responsible for about 30 to 40% of all cancers. Recent research has shown several different links between dietary fat intake and breast cancer, especially as of late. Some of the recently examined links include high fat intake during a woman's teen years, as well as high amounts of consumed saturated fats throughout a woman's overall lifespan, including those early years. Throughout all the studies conducted trying to determine a link between a specific type of dietary fat, i.e. saturated fats, and breast cancer risk, only moderate association seems to exist, but this is still a cause for an increasing public health concern. We will examine these links throughout our presentation. All in all, though, diet alone seems to neither be a direct cause nor a cure for cancers, specifically breast cancer. There are also various research methods that have occurred to study the relationship between dietary fat intake and breast cancer. These include randomized controlled trials, prospective cohort studies, and meta-analyses. Some research has claimed increased saturated fat intake during early adulthood may increase breast cancer risk. The Smith-Warner article mentions how researchers compared and contrasted 8 of the largest fat intake and breast cancer cohort studies. Their findings stated consuming a high-fat diet during adolescence may increase breast cancer risk, but more research is needed to confirm their hypothesis. Another study was a large cohort study of 39,000 premenopausal women. They completed food frequency questionnaires about their high school diets. Although there was a slightly larger occurrence in women who consumed more fat as a teenager having breast cancer, again, more research is needed to solidify this thought. Although, as much with research today, another cohort study, which was spanning over 20 years with 80,000 women, found no strong correlation between dietary fat intake and breast cancer. However, there is evidence that weight gain throughout adulthood can increase breast cancer risk in postmenopausal women. In summary, excessive intake during adolescence and weight gain during adulthood may increase cancer risk. But again, there is not enough evidence to strongly suggest that consuming fat in moderation may increase or decrease breast cancer risk. All this said, the research of dietary fat in particular and cancer has greatly impacted public policy. It first started about 60 years ago with an animal study. This study showed that the amount of dietary fat taken in could influence the occurrence of mammary tumors in rodents. Through many different studies, including ecologic, migrant, case control, and prospective, the big hypothesis that reduction in the percentage of energy from total fat during midlife and later will decrease in the incidence of breast cancer, but this is not always proven correct. According to Willett, a recommendation was made by the National Research Council in 1982 that the fat content of the U.S. diet be lowered from an average of 40% to 30% of calories. This was in hopes of a reduction in cancer rates. Any epidemiologic findings were swiftly made into public policy. Reducing fat has become a major public health model, with the suggestions of eat no more than 30 grams of fat per day, get no more than 10% of your calories from saturated fats, and avoid trans fats altogether. Another popular suggestion these days for the public is substituting monosaturated fats, particularly olive oils, for other sources of energy. There is evidence that eating more monounsaturated fats might lower an individual's risk of breast cancer. There are many organizations out there that help educate the American public on breast cancer, including American Cancer Society, National Breast Cancer Foundation, and the Breast Cancer Research Foundation, to name a few. All in all, If you have any other questions regarding any of the topics that we discussed today, please feel free to reach out to any of us via the discussion board or our emails, and we'd be happy to try and answer them the best we can. Each of us enjoyed delving a little deeper into this link between dietary fat intake and breast cancer, and look forward to learning even more throughout this course. Thank you.